New this morning, a disturbing story out of California. An elderly woman being cared for at a Bakersfield retirement facility is dead after a nurse at the facility apparently refused to perform CPR. Veronica de la Cruz is here with more this morning, and you hear that headline and you think, what really happened?
Yeah, no, absolutely, Erica. It's nice to see you. Good morning. Good morning, everyone. A staff member called for help, but then refused to follow instructions from a 911 dispatcher, even as she pleads for someone to help. The staff at Glenwood Gardens in Bakersfield, California, called 911 when an 87-year-old collapsed. The 911 dispatcher alerted the fire department but determined that there wasn't enough time. The collapsed woman needed CPR right away. But the staff at Glenwood Gardens is not allowed to administer CPR.
We need to get CPR started. That's not enough, okay?
Yeah, we can't do CPR.
Okay, then hand the phone to the passerby. If you can't do it, I need to hand it to the passerby. I'll have her do it. Or if you've got any citizens there, I'll have them.
No.
Anybody there can do CPR. Give them the phone, please. I understand if your facility is not willing to do that, give the phone to that passerby, that stranger that had that dent. This woman's not breathing enough. She's going to die if we don't get this started. Do you understand?
I understand.
Okay.
I am a nurse, but I cannot have our other senior citizens who don't know CPR.
I will instruct them. Is there anyone there who's willing? Okay. I don't understand why you're not willing to help this patient.
I am.
Okay, great. Then I'll walk you through it all. EMS takes the liability for this, Colleen. I'm happy to help you.
But the nurse, following the facility's policy, insists on waiting for the fire department to arrive.
I understand if your boss is telling you can't do it.
Yeah.
But if there's any, as a human being, is there anybody that's willing to help this lady and not let her die?
Not at this time.
The patient died later that day in a hospital. The senior facility released a statement that reads in part, "In the event of a health emergency at this independent living community, our practice is to immediately call emergency medical personnel for assistance and to wait with the individual needing attention until such personnel arrives. That is the protocol we followed." And the statement adds, as with any incident involving a resident, we will conduct a thorough internal review of this matter, but we have no further comments at this time. Despite these tragic circumstances, the woman's daughter says that she is satisfied with the care that her mother received at Glenwood Gardens, Erica.
But wow, it just really gives you pause to hear how all of that played out. I think I'm still processing. Veronica, thank you. Nice to see you this morning.